Welcome back, everyone. Today we are tackling the Primary Health Center or PHC, its functions, staffing, and day-to-day working. Dr. Joshi, to begin at recall level, what is a PHC in the Indian public health system?
A primary health center is the first point of contact between the community and a medical officer within the government health system. It provides integrated preventive, promotive, curative, rehabilitative, and palliative care. For exam writing, remember coverage norms, typically 30,000 population in plains and 20,000 in hilly, tribal or difficult areas, supported by several sub-centers and linked upstream to the Community Health Center or CHC as the first referral unit.
Great start. Moving to explain, what are the key functions a student should enumerate in a short or long answer?
Organize your answer under 6 headings. 1. Outpatient and basic inpatient care. Daily OPD for common illnesses, a small IPD observation capacity in many centers, minor procedures and dressings. 2. Maternal, newborn, child and adolescent health. This includes antenatal care, safe and normal delivery services in designated 24/7 PHCs, postpartum and newborn care. Growth monitoring and nutrition counseling, school and adolescent health services. 3. Immunization and communicable disease control. Universal immunization program, tuberculosis services in coordination with district teams, malaria diagnosis and treatment and outbreak detection with rapid response. 4. Non-communicable disease services, screening and follow-up for hypertension, diabetes, and common cancers under national programs integrated into routine OPD flow. 5. Public health and community processes, health promotion, sanitation and safe water advocacy, village outreach sessions such as village health and nutrition days, and coordination with accredited social health activists or ASHAs, Anganwadi workers, and local self-government bodies. 6. Support services, essential laboratory tests, pharmacy and drug logistics, health records and reporting through the Health Management Information System or HMIS, referral transport linkages, and medico-legal care where authorized. Remember to add ASHAs at village level, though not posted at the PHC, they are linked to it and crucial for mobilization and follow-up.
Nice. Now, a common Viva probe, working hours and workflow. What would you say about a typical day's working?
Describe it as a continuum of facility and fieldwork. In morning, brief team huddle to review admissions, emergencies and plan the day. OPD registration begins. The medical officer and staff nurse run clinics for acute care, antenatal, immunization and chronic disease follow-up. The laboratory technician processes tests. The pharmacist reconciles stocks and dispenses medicines with counseling on dosage and adherence. By midday, outreach teams move for scheduled sessions, village health and nutrition day, school health, home-based newborn care follow-ups, or conduct house-to-house feeler surveillance in season. In the afternoon, review of line lists, referrals and defaulter tracking, data entry to HMIS, cold chain checks for vaccines, and cleanliness and infection prevention rounds. While on call and 24/7 in designated centers, a rotational duty roster ensures round-the-clock delivery and emergency first aid with referral linkages to the CHC or district hospital. Also, monthly there is a convergence meeting with frontline workers and quarterly supportive supervision and refresher training.
Examiners love logistics. How do you integrate that?
For logistics, mention drug stock norms, first expiry, first out practice, temperature logs for cold chain, and periodic physical verification by the officer in charge.
Let us push into analyze. Vignette 2. A cluster of fever with rash is reported from 2 villages. Rapid tests for malaria are negative. What should a well-functioning PHC team do over 72 hours?
Okay, so in hours 0 to 12, come verification and initial response, where the medical officer reviews case definitions for suspected measles or dengue depending on presentation, alerts the block or district surveillance unit and prepares a line list. The laboratory technician collects appropriate samples as advised. The A&M and MPW male conduct rapid door-to-door case searches and health education. Between hour 12 to 36, control measures. For example, if measles is suspected, set up vitamin A supplementation for eligible children and isolation advice. If dengue is suspected, initiate source reduction and coordinate with local bodies for container management and solid waste actions. Lastly, between R 36 to 72, data risk communication and follow-through, which is update HMIS, send daily situation reports, and conduct community meeting with accredited social health activists and Anganwadi workers. Review commodities, oral rehydration salts, paracetamol where indicated, rapid diagnostic test kits, and adjust indents.
Excellent. Now, many students fumble the differences between a sub-center and a PHC. How would you pitch it in 2 lines?
Say a subcenter is the most peripheral contact point led by an auxiliary nurse midwife or ANM and a multipurpose worker or MPW, male focusing on outreach and domiciliary services. A PHC is facility-based, doctor-led, providing integrated clinical services, supervision, supply chain management and referrals for its subcenters.
Nice and crisp. Coming to quality and safety, what routines demonstrate a culture of safety at a PHC?
Mention standard treatment guidelines, infection prevention and control, hand hygiene stations, biomedical waste segregation, needle stick injury protocol, equipment and cold chain maintenance logs, near-miss reviews, maternal and perinatal death reviews where applicable, and display of citizens' charter and service timings. If time permits, add patient privacy and respectful care as explicit standards. Examiners appreciate that.
Could you give a short list of records and registers you expect to see?
It's often asked in exams. Delivery register, outpatient and inpatient registers, laboratory register, immunization due list and session registers, family planning register, drug stock and indent books, equipment maintenance log, referral register and monthly HMIS reports. Emphasize complete, legible, timely.
That wraps it beautifully. Could you give an exam-ending summary paragraph students can reproduce?
Okay, a primary health center is a doctor-led facility serving 20 to 30,000 people, delivering comprehensive preventive, promotive, curative, and palliative care. Core functions include outpatient and inpatient services, MCH and adolescent health, immunization, disease control, non-communicable disease screening, health promotion, and essential laboratory, pharmacy, and referral services. The team, medical officers, nurses, pharmacists, laboratory technician, field workers, and support staff, operates through Clinic Plus outreach workflow, maintains HMIS systems, and coordinates with community workers. In emergencies, the PHC triages and refers. A well-run PHC is the cornerstone of universal continuous primary care.
Thank you, Dr. Joshi. This was lucid, application-oriented, and exam-ready.